the acquisition of these PPEs, and indeed all health commodities to ensure that we deliver value to our people. And I wanted to make those remarks because obviously there has been press reports about the prices that were there before for PPEs, the prices that were there for face masks, but I would like to say that anybody doing a little research will find that that indeed was the situation across the world at that time.
All right, so that is Health CS Mutahi Kagwe there responding to some of the conversations that have been going on about PPEs, about millionaires, about all these things that we perhaps never thought. Yvonne, while you are away, I saw something that was doing the rounds on social media, that at the end of this, other countries will come up with vaccines. Here we'll have millionaires.
Yep. And going by the cost of both, a vaccine and corruption, you can see, yeah, either way, somebody will be making millions. I mean, I think that is the interesting bit. And I have to say, you know, like we were discussing during the break, that you remember the punchline that, you know, Francis did. I mean, I think just at the very start.
Coronagate.
Coronagate. And you warned us that as sure as the sun will rise every day, that there will definitely be a scandal around this. You know, and here we are again. And I think, you know, that piece that was done, you know, by Paul Wafula, you know, some great work that was done there. And then, you know, certain names that are coming up that seem to be very interested in the health sector. And you also know the links to some of these names. It then makes you wonder whether this will go anywhere, if how the Afya House scandal with the 5 billion shillings for the containers is anything to go by. And it is completely despicable.
What's wrong with us?
What is wrong with us? It is completely despicable that we would be benefiting. I mean, companies that are, you know, 6 months old and suddenly you have the capacity. One of the things I know about tendering is you have to show the capacity that, one, this is something you've been doing, you have experience in doing.
They should write books, how to win a multi-million shilling tender in 6 months.
Because the issue that I have is about how to win tenders and the millions people are making at the expense of what? These are at the expense of no PPEs, no masks, no equipment, no necessary medication and equipment
of
and
now,
care.
399 people who died as of today.
As of today, yeah.
The cases are rising.
The cases are rising. We've had 24,411 people confirmed with the virus. We hear about ICU beds in Nairobi all full because of people who are suffering from COVID-19. In fact, the minister was saying, oh, the counties are not going to come to our rescue in case Nairobi and the bigger towns experience what they're experiencing right now, which is no space in the
But even Nairobi itself is overwhelmed.
Nairobi is overwhelmed. And when you talk about counties, where will they get the equipment? Where will they get the PPEs? We talked about how they don't have enough beds, Gashuri. There's a list you talked about back then. And we keep saying, oh, we hope that we'll not get to a point where we'll be like Italy or Spain a couple of months back. We'll not be able to cope. And we need money for this. We have nurses and clinical officers threatening to strike come Monday because, one, they don't have the equipment they need. Two, they have not been paid. Some say since May they have not been paid. This is August. I think we've had over 700 medical workers who have been infected by COVID-19. We've had 8 who have died so far. And our priorities amaze me as a country, especially now. Even before COVID-19, our health care system was not the best. There were challenges. But now with the added burden of COVID-19, and then people not getting what they need, especially those we are calling frontline warriors, frontline workers, those supposed to fight COVID-19 for us, we're in trouble.
You see, Joe, I don't know why we are surprised. We shouldn't be surprised.
Not least of all because you told us so.
We sat here and we talked about it. The Coronagate. I still remember Joe's choice of words that day. The Coronagate scandal. You see, calamities and crises of this nature make billionaires. There are people, I would call them disasterpreneurs. They're just hovering around disasters. They know once a disaster strikes, it's an opportunity to make money. And not just small money, huge money. You remember the sugar shortage? Sugar made billionaires. You remember the maize
shortage? The maize that came from Mexico.
Yeah, made billionaires. Do you remember during the floods not so long ago, and some items were bought at crazy prices?
And can we talk about drought and now all the dam scandal that surrounded that?
So every crisis will create billionaires.
I remember
In
actually
fact,
during the HIV and AIDS one, I remember a report that said that only 6% of all the money that had gone into this whole thing were actually spent on fighting HIV and AIDS. The rest were in emoluments, those allowances that people get in conferences, and all manner of things that did everything else other than directly deal with fighting this. And that is actually how it is.
Yeah, you see, let me give you, by way of analogy, here you are, you've been given resources to take care of a patient. Yeah, umepewa uji ya mtu mgonjwa, chakula, fruits. Instead of making sure that the patient feeds, you eat the fruits. You drink the porridge, you drink the milk, and all those things that were meant for the mgonjwa. Yeah, you eat them.
Hungry.
And unapologetically so.
Yeah. In their face.
Yeah, you see, yesterday I keenly watched as the CS Health tried to explain that procurement, and whatever he was saying was not on the written speech, because I have the written speech. It was off cuff. But did you notice that he spoke while
looking down?
Yeah, looking down. Why not up?
Yeah.
Eyeball to eyeball? Tells you something. The enormity of the discussion that we are talking about here. And you also remember when a certain report came to Parliament that had some very interesting looking figures. And there was a lot of discussion about it. The media was accused of misleading the country and so on and so forth. That matter ended up that way, but still does not take away the demand by many citizens that the Ministry of Health must account for the COVID billions. It's a bare minimum. The ministry must tell us, this is the amount of money that we have received, this is how we have spent the money, these are the items that were procured, by which company, at what cost, so that people can do a comparative
procurement procedure.
Can do a comparative study. Otherwise, people will start questioning a few things. In fact, there's a tweet here by a gentleman called Ayamba Vin. He says, COVID is real, but it becomes more real when the pockets are fattening. This thing is not going anywhere soon. You see the kind of discussions that begin? Very well.
That's very loaded.
Here's some examples. Remember there was money that came from the World Bank to hire, additional health workers. And you're hearing from KMPDU, I think Chibanzi Mwachonda has said, we need to hire about 1,000 jobless Kenyan doctors and ramp up, in fact, the county medical workforce. And he is talking about 15 new doctors per county. So, times 47, you can do the math. But they've also raised the issue about medical workers' insurance compensation scheme. And the fact, for me, that doctors pay their own bills. I mean, how ridiculous is that in the country? You've sent your warriors to the front line and they have no weapons, they have no protective gear, but you expect them to win this war. And then just recently,
it's like sending our soldiers to Somalia in slippers and t-shirts.
And slippers and a razor knife, and a razor, literally, and hoping that they would be able to win that fight. The president, again, just recently asking the Ministry of Health to fast-track the use of the 3 billion shillings to cushion the health care workers. So we're seeing a lot of, we will put money towards... Then actually do it. What does it take, for example, to hire these doctors? KMPDU knows, the need. KMPDU knows where they're needed the most. Even the, KMPDC as well understands this. And then in the face of all of that, there's some things that are just done in the country that just say that maybe we're a little tone deaf. So in the middle of all of this, KMPDU is still asking for more doctors to be hired, and we bring in 20 Cuban doctors.
And
Yvonne, okay. And they continue to argue that they're being paid. This was the same story we had when the first 100 came in to the country 2 years ago.
But it really doesn't matter.
That they're being paid, the same. But it really doesn't matter. They're here for 6 months. They're here in internal medicine, oncology, cardiology, renal, and pediatrics. They'll be based at the Kenyatta University Hospital. But, they're just some things that are in bad taste when we have so many of our own doctors that, by the way, are saying, I am here. They're calling up and registering for service. Send me to the front line. And then we have the 20 Cuban doctors. And this is not anything against them. But you see, what the KMPDU is saying is we have qualified healthcare workers who have been trained with taxpayers' money. but who are not being considered. And this is what they were saying just towards the end of July, which was what, a week or two ago. There just needs to be, action following decision making, because a lot of what we hear is we have put in place. I am asking that this is fast-tracked, and the money is already here. That money already landed here, but look at where we are. And then when you hear this happening in the face of corruption, it's really difficult.
And then speaking about the doctors and healthcare workers, we even had the minister at one point saying now they're asking the retired nurses and medical officers who can work in ICUs to come and help out. Most of those retired are at high risk of COVID-19.
They're more vulnerable.
Yeah, they're more vulnerable. You're asking, what about the young doctors and young clinical officers and then medical officers who are trained and ready to do the job?
But also because it takes quite a bit of time to train ICU specialists. Remember, that was one of the things that the doctors had talked about in their 100-day strike that took place just before, the election in 2017. But here are some good things or interesting things that are happening. The CDC isolation guidelines, right? That they've now completely, changed things up a little bit. That they're saying a test-based strategy is no longer recommended to determine, when you can come out of isolation and go back home and, back to the workplace in certain circumstances. So saying you wouldn't need a second test and you only need to isolate for 10 days if you exhibit no symptoms, or if there's been at least 24 hours since your last fever without using any medication to treat that fever. So, I think there's some interesting things that are happening. Also encouraging is to see lately the number of recoveries are starting to match the number of new cases. For a while there, the number of recoveries has started to drop off. But I think today we saw about, 534 recoveries?
In total, you have about 10,440 something who've recovered. And then
which is about 43%
43% of that.
Even though there are usually some people in between that we're not quite sure where they are. But at least, 43% looks good. Even the death rate is still 1.6, I think, thereabouts, which is... it compares well with the global average, which is close to 2%.
And the infection rate is now down, but today, you never know.
Today was single digit, so that is a good thing. If it can keep going down, at least we'll know that perhaps we are somewhere around that peak. But, you never know. There are always questions about where they do the testing and all that. But I wanted us to talk a little bit about the school calendar because...
Job, just before you go there, Joe, there's a gentleman here called Joachim. He tells me, you guys, PPE kits, 3-ply mask, KN95, ventilators, prices were dictated by demand and supply rule. All countries globally were sourcing from China. China was enjoying the monopoly. China did set the price globally. Mode of transportation was a problem. So he's saying the prices were justifiable. Well, that's arguable. What is important is let's have a breakdown. Let's be told this is the amount of money that was spent. It was spent on A, B, C, D, procured from who and at what price. So that Kenyans out there can now make their own assessment and see whether there was value for money or not.
Did those prices actually make it possible for companies that were less than half a year old to...
Surely. Exactly.
There are many other questions beyond just the price of this, I think, that will need to be discussed.